Welcome, everyone, to our Maddie's Insight webcast, where we hear from experts in the field of animals and animal welfare. Each session contains highlights of research results and then actionable recommendations based on those results so we can translate that research into real life advice. I'd like to welcome Bailey Eagan, who will be talking about the use of a standardized behavior modification plan and daily gabapentin administration on the behavior of fearful cats from hoarding situations. Bailey is a PhD student at the University of British Columbia and specializes in animal behavior and welfare in animal shelters. She has a particular interest in conducting applied animal behavior and welfare research and incorporating those research findings into animal shelter practice. So our webcast is a really good fit for Bailey's focus. Her current work focuses on using anxiety medication in behavioral treatment plans of shelter animals. Welcome, Bailey.
Thank you very much for that introduction. Thank you very much for having me here today. I am really delighted to be here. I got a chance to look at some of the people who had registered at the list yesterday, and I got very excited because I know there's a lot of expertise in this group. So I think we're set up for a good session and lots of good conversation here and later on the forum. As mentioned, I'm currently a PhD student at the University of British Columbia, snowy British Columbia today, in fact. Now, before I begin getting into the results of our study that was gabapentin and behavior modification for shelter cats, I want to mention some of the people that I worked with on this project. First, my PhD supervisor, Dr. Alexandra Protopopova, who's here at the University of British Columbia, as well as Dr. Karen Van Haften, who's a veterinary behaviorist whose extensive clinical experience in helping fearful cats in shelters really guided a lot of this project that I'm going to be talking about today. And unfortunately, Karen and I were actually meant to do this presentation together today, but she had a last minute work trip, so she's not able to make it for the presentation. But we did very much work on this project and the presentation together. So I got to talk to Karen about some of the specifics of what she wanted to communicate as a vet behaviorist with lots of experience in shelters in terms of practical tips. So I can assure you that while Karen's not here, her information and expertise will very much be included in what we'll be talking about today. And I'd also like to mention our incredible animal care and research teams. So this is a fantastic group of people who were responsible for the very careful care of the study cats and many aspects of the research that I'm going to be talking about. So what's our plan today? What I love about this session, as was mentioned in the intro, that we're going to be talking a lot about not just research, but how we can apply that research into shelters, which is really an area of passion for me. And this is really, I think, what inspires a lot of the research that we do in shelters is the ultimate goal of applying that into these environments to help animals. So what I'm going to do is share the results of the research project from a pretty unique opportunity we had to conduct this in the previous year, but it's going to be a little bit different than a regular research presentation because we'll be focusing on those applications. But if there is anything about the project that afterwards that you feel you want to dive into more, I really do encourage you to reach out to me because I'll always be happy to chat about any aspect of this with anybody. So for this project, looking at gabapentin and behavior modification for fearful cats, our study team, when we were setting out, we were really driven by a simple question of when a highly fearful cat enters a shelter, how can we best help that cat? As we know that when a fearful cat is entering a shelter environment, decisions about the outcome of that cat to treat in shelter or to euthanize often have to be made right on intake or in those first couple of days at a time when the cat is also most likely to be their most fearful. And then, of course, this dilemma is particularly pronounced in cats from hoarding environments. And I want to caution you quickly before I put this up. I'm going to briefly show a photo of a hoarding environment, and I'll just show this once in the presentation. It'll only be on the screen briefly. So we know that hoarding happens around the world, and it's a very poorly understood phenomenon. It is a recognized mental disorder in humans, and we, of course, know that these environments can present substantial health and welfare challenges for not only the animals coming out of these environments, but also the people who are in those environments as well. We do have limited research that shows that when hoarding environment cats enter shelters, their survival rates can range from 0 to 100%. And this is primarily due to their high prevalence of medical and behavior issues that they often enter the shelter with. And behavior issues on intake, especially those high levels of fear, can commonly lead to euthanasia. But there's currently no widespread standards of care for treating those highly fearful behavior issues. And then further, there's no research assessing fearful hoarding environment cat in shelter behavior over time. However, there is some hope. There's some recent research on hoarding environment cats that I find very exciting. This was conducted by Jacobson and colleagues at the Toronto Humane Society, and they found that hoarding environment cats, despite their known challenges in shelters, can have a length of stay and live release rate that is similar to non-hoarded cats. And they also found that hoarding environment cats can be highly adoptable, have reports of high satisfaction from adopters, and also frequently show social behaviors in the home. So in fact, they are showing through research that some of these negative outcomes for cats, there might be more hope than what we may initially expect. And I want to bring your attention to some interesting results from their most recent 2022 publication on hoarding environment cats. So this is on the left side of the figure in that pink circle. This shows the percentage of cats that were reported to be super social or social at 3 time points. So one was the 1 week after being in the shelter. So that's the blue bar that you see. Next is within a week of adoption. That's the middle peach bar. And then third is over a week post-adoption. So that's the gray bar. And what you can see there is that a large percentage of cats fell into these categories of social or super social after a week in the shelter, after more time in homes, despite being highly fearful on intake. So from these studies, the authors conclude that hoarding environment cats have a high potential for successful treatment and adoption in homes. And they also suggest that as a hoarding environment cat will likely be highly fearful on intake, to try to wait at least 5 days to allow the cats to acclimatize to the shelter before making outcome decisions if it's appropriate and possible in that specific situation. Now, the treatment of fearful cats from hoarding environments, though, of course, does require careful management and care. And some common strategies do exist for treating fearful hoarding environment cat or fearful cats in general that can be applied to hoarding environment cats. Behavioral strategies to decrease fear of humans in shelters include behavior conditioning programs and behavior modification programs, or BMOD programs, as I will frequently be saying throughout this presentation, BMOD to mean behavior modification. And then other techniques that we use commonly with fearful cats, such as low stress and passive handling techniques to help try to make those experiences with us less fearful, can also, of course, be beneficial. And then furthermore, fast-acting anxiety medications may be beneficial in the treatment of hoarding environment cats. So the medication I'm discussing today that you, of course, know of, Gabapentin, an inexpensive medication that's commonly used for epilepsy and pain in cats. But a growing body of research has found that a single dose of gabapentin has been shown to have anxiety-reducing effects in cats in vet appointments, and that's those studies range from 13 to 36 milligrams per kilogram for decreasing signs of stress in situational vet appointments. And then further, there's a study that looks at a single dose of gabapentin decreasing fear responses in trap, neuter, and return cats. And that's at a dose range of 9.2 to 47.6 milligrams per kilogram. So quite a range where we're seeing these impacts. However, what hasn't been looked at yet until our study, to my knowledge, was daily gabapentin administration for the ongoing anxiety reducing effects in cats, or in combination with a behavior modification program. So this study has 2 primary aims. The first is to assess the effects of daily gabapentin at 10 milligrams per kilogram on behavior modification progress and behavioral indicators of cat stress. And so 10 milligrams per kilogram, we selected that because we wanted quite a low dose that could be given on a continuous basis to minimize seeing side effects and really trying to see what that smallest amount could do. And right away, I will say, we did find it when successfully administered, gabapentin was helpful in the treatment of cats from hoarding environments. Throughout this talk, I'll go through the specifics of what we measured and what we found, but I don't want to build any suspense. We did find daily gabapentin was helpful. And our second aim was to report on the behavior and in-shelter progression of hoarding environment cats in general. Because we know so little about hoarding environment cats and what it looks like when they're settling into the shelter, we wanted to dig in more. So how did we go about doing this? We had a very unique opportunity that I'm very lucky to be a part of, where we were able to create an animal shelter research lab at the British Columbia Society for the Prevention of Cruelty to Animals. And this meant that we were able to bring in cats into the shelter that was set up not only for the high needs care of these hoarding environment cats, but it also had the added great benefits of being filled with behavior monitoring equipment that allowed us to conduct our research project. And then it was also closed to shelter visitors. So until it was time for a cat to be up for adoption, we didn't have people coming through our study area looking at the cats, because we only had cats that were going through our treatment plan and then were ultimately adopted at the end. Cats entered this animal shelter research lab in staggered intakes from 3 different hoarding environments for a total of 37 cats. Upon intake, an intake exam was conducted by Karen, our veterinary behaviorist, as well as shelter staff, and then they entered into daily shelter care. And I put up these 2 cats because I wanted to mention a lot of our cats look the same just by nature of coming from a hoarding environment. This happened to be a common trait. So I swear I'm not just showing the same cat again and again. This is indeed individual cats that you're seeing. Of the cats that got that intake exam and were deemed to have moderate to severe fear, they, during that intake exam, they entered into randomly receiving either 10 milligrams per kilogram of gabapentin or placebo every 12 hours in an ongoing basis. And we were all blinded to what treatment each cat was on, so we didn't know whether we were giving gabapentin or placebo. But we did have unblinding protocols in place in case a cat was not progressing or showing too extreme levels of fear as assessed by the veterinary behaviorist, in which case then they would get individualized treatment and we would remove them from the study. And this is one of those moments I kind of want to stop and really dive into the specific aspects of that gabapentin administration that we did and which we had success with, because I know many of you are very experienced with this sort of thing. So you'll likely be curious about the specifics. I mentioned this is a low dose of gabapentin or placebo. Generally, we see about double this used for situational scenarios, such as a vet appointment. So this was quite a low dose. And it was given at the discretion of a veterinarian. So our exclusion criteria, so cats that were automatically removed, they were those that were apparently sick or had suspected organ failure, especially any potential concerns about the cat's kidneys, they would not be entered in. We also didn't include cats that were pregnant and were going to go to term, cats that were younger than 12 weeks, or cats that were already friendly, because of course, that was our ultimate goal. So if they were already friendly, they didn't need to be entered in. And then if none of these applied to a cat, then they were considered for the study. And for the study, we used a liquid formulation of gabapentin or placebo, so identical mixtures, but one was GABA, one was placebo. And we did this because we needed really exact dosing. We needed everybody to be getting 10 milligrams per kilogram. We would not, if we weren't doing a study, we wouldn't have needed to have quite this level of specificity. When we were administering the gabapentin, our best bet, because we wanted it to be as minimally invasive as possible. So we would offer it first in food, and we would try a bunch of different tasty foods, and we would see if they would eat that, which was fantastic when they would do that. If not, we would put it on their paw, and then if they were a particularly clean cat, they would lick it off their paw. So that was another way to get it into them. And then if neither of those options worked, we would use a syringe or a catheter on the end of a syringe, and we would give it to them that way. But if we couldn't do any of those 3 ways without them escaping or trying to escape, we then would just skip that dose and we wouldn't give it to them. So we felt that it would be too counterproductive to what we were trying to achieve, is if we needed to wrestle them to get the gabapentin in. So they had to be accepting one of these ways in order to be a part of the study. Now, I mentioned this liquid versus capsule because capsule formulation is generally cheaper than liquid if you're getting it, and it's often precise enough for the needs of a shelter. So at the BCSPCA, for example, where the study was conducted, normally they would just take a 100 milligram capsule and they would split it in half and mix about half of the contents into the tastiest wet food that they could find and try to give it to them that way. So that if doing that, it would be about 50 milligrams, which is 10 milligrams per kilogram for your average 5 kilogram cat. So a little bit of highly specific information on gabapentin, as I know you guys will administer this often. So then of the cats that were entered into that trial, they entered into our standardized behavior modification program. And this was aiming to gradually increase exposure to humans to ultimately decrease the fear of humans. And I'll also break this down a little bit more in terms of the methods because it was such a big part of our project. And I also hope it may be useful for those of you who want to use these sort of programs in homes or in foster homes or in homes or in the shelter. And I hope we can chat about some of this too if you have experience with this. And I'll mention too, I'll be going through this infographic here. This is a downloadable resource that anybody can access. I'll put up we have a link that will be shared. I'll put up a QR code at the end. So if you want access to this, you can certainly have it. So I'll go through the steps. There was a 6-step program. The first one was meeting minimum welfare assessment criteria. So before we could start potentially increasing the fear that these cats were experiencing in the shelter, we would first make sure that they were eating, drinking, and using the litter box, at least when we were not in the shelter. So we wanted to make sure at minimum they were at least feeling comfortable enough to do these things. Once we saw some evidence of them eating, drinking, and using the litter box, we would then try eating with a person in the room. So for this, we would get a plate, we would put our best bet of the highest value food we could find, and we'd place it in the room, and then we'd stand back about 3 feet, and then we'd wait and see if that cat was comfortable eating with us in the room at a distance. Once they were comfortable eating with us in the room at a distance, we moved forward to step 3, that is eating from hands. And I'm showing 2 versions of this. On the left, this is where we would always start, where we'd start with food at the end of a spatula, and then gradually over sessions, we'd move our hand up a little bit further, until the cat's then eating it right out of our hand. So that's a cat on the left that's just starting step 3. Here's a very comfortable looking cat on the right, eating right out of the hands. Step 4 was allowing light touch and gentle petting. So for this one, we were making sure to pair with food, and we were using squeeze ups, which you're seeing here. We had such incredible success with squeeze ups. We found these cats absolutely loved it. I don't know if you guys have similar experiences, but oh my gosh, we had success with it. So we would start by giving the food and then not even touching at first, just lightly grazing the top of their head. And then gradually we would build that up until they were comfortable with us allowing light touch from us. But I expect a few of you noticed we made a bit of a mistake here in this video, because when pairing the potentially scary stimulus of us with an unconditioned stimulus of food, you would usually want to present the petting hand followed by food, which we don't do 100% of the time. At one point we get it a little backwards. So thankfully we found, even with us sometimes getting this backwards, we did have success overall with this BMOD program. Step 5 was increasing petting and scratching. So at this stage, we moved on from light petting and scratching, and we would try full body pets, increasing the intensity a bit more, incorporating some scratches elsewhere to see if they will enjoy that. And at this point, we would start removing the food to see if they would stick around for petting alone. Was petting itself starting to be a bit of a reinforcement for being near us, or was it just the food? And then once we were increasing the intensity of petting and scratching a bit, the last test is step 6 of seeking human attention without food. So at this point, once they were consistently approaching us like this, regardless of if we had food or not, we were very happy to graduate them from our behavior modification program. And then at this point, this is when they would be put up for adoption, and people could come in and meet them and see if they could go into homes. Now I mentioned here BMOD tracking. So I keep putting up Karen's picture here in the corner, as she developed this BMOD program and has always tracked, even outside of studies, tracks BMOD, and it's a really helpful way, not only when you're researching BMOD, of course, because you need to know the date and time, the BMOD level, what food was used, any specific notes about what that cat particularly liked, or who was doing the BMOD, but it's useful just in practice anyways, outside of research purposes, just for seeing how a cat is progressing or not, so you can know if over days is this cat improving. Also, you can keep track of preferences, and I found, not only for research, but I found just daily in the shelter that this was a very, very helpful resource to have, and it really helped us do better BMOD, because we were collecting data as we went, and we could see, oh, this cat loves when we microwave the food before trying it, or something like that. So it helps do the best BMOD that we could do, we found. So I really encourage BMOD tracking, and these forms are available too, or using something similar to this, I'd certainly recommend. And then before I move on from BMOD, I'll also mention a couple of the things that we made sure to do just to ensure that we were following these methods each time, and things that we continue to do with our BMOD today. So we were always very careful to go slow and steady, slower than we would almost feel we would normally need to. We made sure to be really quiet, especially when we were in the cat rooms, but just in the shelter in general, to make sure we were not adding any unnecessary fear to their environments. And then when we were doing BMOD, we would avoid eye contact as well. So we would make sure we weren't coming in and looking at them too intensely or anything. We tried to avert our eyes. We also kept it really brief. So BMOD was not a big time investment for us. We would try to keep it to just 2 or 3 minutes per cat. Our goal was just get in, pair us with something really positive, and then get out. So even if we had 10 cats in the shelter, we could be done all of a total round of BMOD in about 30 minutes. So it was nice that we could go quite quickly. We also always tried a variety of treats. So we'd usually start with a plate that had a bunch of different options, and then quickly you'd learn which cat preferred what. And then of course we can record that on the BMOD tracking forms, and then that kind of know this cat loves squeeze ups or whatever it was. We made sure to never force interaction. So we weren't so much set on trying to get the most BMOD progress. Our goal was just to make sure the cat was as comfortable as possible. So if we were forcing interaction, we knew we were going too far. We tried to just go really slow and steady. We also knew it was okay to go back a step. Cats, in our case, sometimes they were step 4, sometimes they were step 3. It was a little bit of a slow wiggle up to that graduation. It wasn't always exactly linear. Sometimes it was, but as long as there was no major backward progress, that's we knew that was okay. And then we also had a variety of staff that were doing the BMOD. So unless a cat was highly, highly fearful and seemed to have a clear preference for somebody, we tried to expose them to different people as well, just to make sure that they weren't only comfortable with one person, and that this could hopefully generalize to others. And I also found this encouraging too, because it's also not realistic in a shelter to have one person doing all the BMOD. So we tried to keep it as realistic to what a real shelter environment would involve. And we found that was fine, not only for training people, where a variety of people were able to learn it quickly, but also we found it was helpful for our BMOD. Now I'll quickly talk about the other measures before going into the results here. We also recorded a daily cat stress score. So this is a very commonly used behavioral measure of cat stress in shelters that scores cats from relaxed to terrified on a score of a scale of 1 to 7. And then we'd calculate a mean daily cat stress score. So this is an example. The cat on the left is showing a high cat stress score. So you see the dilated pupils, probably fast respiration, kind of a tight body. And then the cat on the right, relaxed, lying on his side, maybe doing a little bit of slow blinking or something, that would have a lower cat stress score. So this helped us give kind of a rough snapshot of how cats were doing and tracking that over time. So this is something that could be implemented in the shelter too, if you wanted a quick measure of how cats are doing. Another measure we looked at was latency to emerge from hiding. So this is a kind of a more formal test that we sometimes see in the literature to assess boldness in a new environment. You see it in cricket and fish literature, for example. But what we did is we conducted an altered version of this, as we noticed, especially at the beginning, some cats would initially spend the entire day hiding, and then as soon as we'd leave the shelter, they'd come out at night, and that's when they'd use their cage and do everything. So what we wanted to record was the latency to emerge from hiding after the last person left the room at the end of the day, as we predicted that it would decrease over time as they adjusted to the shelter. And then we also wondered if this would differ between our treatment groups. And for the final measure that I'm going to be talking about today, we measured urine clump weight on the first 3 days in the shelter. So we did this to measure stress based on a recent study by Andrew Konis and colleagues, who found that cats suppress urine when they enter the shelter, and that urine clump weights will increase over time, which is what you're seeing on that figure there, is the litter clump weight. And they also found that using that specific formula that you see on the left to assess urine suppression, that it was linked to likely stress behaviors in cats. So essentially what we wanted to look at was how much did these cats suppress their urine on day 1 compared to days 2 and 3, and then would that differ between our gabapentin and placebo treatment groups. And because I've talked about a bunch of different measures here, I'll quickly zoom out and before sharing the results, just show what the pathway of a study cat looked like. So if on intake, ideally a cat's following that blue pathway through, they would, if on intake they met the study criteria, they would receive 10 milligrams per kilogram of gabapentin or placebo every 12 hours. And then they would move on to daily study procedures and data collection. So all the measures that I've just talked about. Once they graduate BMOD, gabapentin or placebo is then stopped at that point. So they, after graduating BMOD, no more gabapentin or placebo was given. And that's when they'd be placed up for adoption and move to their outcome. However, cats could, of course, at any time in the study follow the red path as well. So if they didn't meet study criteria, they immediately were on a different path, or if they were not progressing in BMOD, or if they were showing extreme levels of fear and needed more individualized care, they would then also remove from the study. So they could certainly still progress to adoption, but they were just no longer getting the gabapentin or placebo treatment group. Now, for statistical analysis, we did conduct a number of models assessing BMOD, cat stress score, latency to emerge, and urine suppression. And for these models, we controlled for other factors like case and sex. But for the sake of practical applications in shelters, I'm not going to spend much time going into this, but very, very happy to chat afterwards if anyone has any questions or on the forum after. But I won't spend too much time on it for now. But I will spend time on the fun things of what we found. So here are the days to graduate the behavior modification program for 33 fearful cats. So as you can see, all but 4 cats on the end there graduated, meaning that they were consistently seeking human attention without treats. And that was in a median of 14 days, which was really much faster than what we predicted. We did have 2 cats that were transferred at BMOD stage 5. So they didn't technically graduate, but they were ultimately adopted when they were transferred to the next shelter. And then unfortunately, we did have 2 that were euthanized due to persistent fear. Now, of course, our criteria to graduate is not actually a requirement for adoption. Therefore, some of those earlier stages of the BMOD program are also likely very relevant to the in-shelter treatment of these cats. So now looking at the top right, it took only a median of 9 days for cats to seek human attention for the first time. So the first day that they hit step 6. Looking at days to step 5, days to step 4, cats were meeting these steps very quickly. And as cats entered the shelter showing levels of fear that could put them at risk for euthanasia, we were surprised and very happy to see that in a median of 5 days, cats were already allowing light touch from humans, which in itself could sometimes be enough for adoption. And in our experience, this was not a large time investment, and almost all cats graduated regardless of treatment group. So we really do see BMOD as something that is worth trying and applying in shelters, especially with those fearful cats. So now getting into the results from the analysis of BMOD and gabapentin by treatment group. So looking at this plot, you see the dark purple line that represents the cats in the gabapentin group, and the light purple dotted line represents the cats in the placebo group. So we found that gabapentin predicted a faster time to graduation from the BMOD program compared to the placebo group. So hitting the bottom of this plot is graduating BMOD. So while the vast majority of our cats progressed and graduated, it did appear that gabapentin was beneficial in speeding up this BMOD progress, which was we see as very, very beneficial for these cats. Now, we also looked again at the effect of gabapentin for time to reach each individual step, 1 through 6. So starting at the top left, this is time to the first step 6, Moving over to step 5 and 4, those all showed statistically significant differences in progression speed between the two treatment groups. When we looked at step 3, 2, and 1, we didn't see a statistically significant difference between those speeds, so no notable changes in those early days. But overall, from this, we did see that they graduated faster and they hit those later stages quicker. So ultimately, we did see that gabapentin was beneficial for behavior modification program progression. So now I'll show you those effects of the behavioral CAT stress score over time. We again did see a statistically significant relationship with CAT stress score and treatment group, with cats being in the gabapentin group as represented in purple, predicting a slightly decreased CAT stress score compared to those that were in the placebo group, which could possibly indicate that cats in the gabapentin group were less stressed than cats in the placebo group, which is consistent with all that literature we saw before showing that cats in vet clinics had lower CAT stress scores than, cats in vet clinics that received gabapentin had lower CAT stress scores than those with placebo. So we were pleased to see this also in an ongoing basis was a difference that we could see. And here's the effect of gabapentin on latency to emerge from hiding. So we also saw a statistically significant difference showing that a cat being in the gabapentin group predicted a quicker latency to emerge from hiding after the shelter closed compared to the placebo group. And I really find this difference in the mean latency to emerge between groups, especially interesting right in those first few days at a time when they just arrived in the shelter. And the time that they're emerging from hiding is also the approximate range of when we would expect peak gabapentin to be in their system. And finally, looking at differences in urine suppression between the two treatment groups, we did find a statistically significant difference between gabapentin and placebo cats, with more urine suppression occurring in placebo cats. So from the other study on urine suppression, that would seem to appear that placebo cats were more stressed, which is consistent with everything else we found. But I do want to mention this was in a smaller number of cats because this is, in order to be included in this analyses, we had to have cats had 3 days of urine data and very messy litter boxes on those first couple days as they were working out litter box behavior. So unfortunately, a lot of cats did have to get cut from this analysis. But from the limited cats, 7 in the gabapentin group, 9 in the placebo group, we did see results that were consistent with the other results and what we would expect. So overall, our key takeaways from this, we found that gabapentin given at 10 milligrams per kilogram twice a day predicted a decreased CAT stress score, increased behavior modification score, decreased latency to emerge from hiding, and decreased urine suppression in that small number of cats for urine suppression. But from this, we conclude that a low dose of gabapentin at 10 milligrams per kilogram was beneficial in the treatment of fearful cats from hoarding environments. And overall, we were also very thrilled to see what we're starting to see more in the literature, these very positive outcomes for hoarding environment cats, thanks to this collaboration of the shelter behavior and veterinary teams. So we saw an 89% survival rate. We saw behavior modification program completion in 94% of fearful cats in a median of 14 days, which was really much faster than what we predicted. And we saw that all cats progressed through the BMOD program in some way, regardless of treatment groups. So this was not, while gabapentin was certainly beneficial, we had success with the BMOD program across all the cats. So we see that as very promising because not all cats are going, that may need it, are going to get gabapentin or other anxiety reducing medication. So behavior modification in itself appeared quite useful. But we do have some limitations in future directions, and most notably, as we're talking about BMOD, we didn't have a control group for behavior modification. So we don't know, we have reason to expect that these cats warmed up to us quicker by pairing us with food and having these positive interactions, but we didn't have a group not getting BMOD. So we couldn't do a formal comparison to know for sure if BMOD compared to nothing was helping. Our only control group was gabapentin versus placebo, and everybody got behavior modification. We also had some small sample sizes for some of the group comparisons. So, for example, we didn't see sex differences. We didn't see notable differences between hoarding environment cases. Meanwhile, if we had more of a sample size of senior versus kittens, for example, I expect we would see differences in BMOD progression between these groups. There were also other variables likely impacting cat behavior. So specific medical conditions, specifics of in-shelter care, for example, some cats getting eardrops, others not getting eardrops, and specific gabapentin administration method that could be impacting these results as well. And then finally, for future directions, we do have analysis underway right now, looking at those daily behaviors. So diving in deeper of what exactly they're doing every day when they're in the shelter. And then we also are doing follow-up surveys with adopters, which so all of these results are pending and will be shared in hopefully future settings. But what we do know from what we followed up so far, we have some fantastic reports of very social, happy cats in homes, and hearing about them continually has been quite a delight and made it all worth it. So we know, despite their tough start, these cats are officially very loved family members. So to wrap up, I want to thank the funders of our study, NSERC, Fear Free, and the BCSPCA. I'd also like to thank Maddie's Fund for having me here today. I'm very grateful to have this opportunity to meet with you all. I also want to mention there's going to be some links in the chat. These links will be on the forum as well for downloading behavior modification resources for fearful cats that you can access here. We'll soon have it available in Thai as well, and hopefully other languages moving forward. So here we have the BMOD resources that you can download. And I'll finish too by mentioning a study that we're working on right now that is a survey study that I would really value your I'd really value your participation if you have 20 minutes to spare. We want to survey people who work in animal shelters in Canada, the USA, or Mexico. And this is about anxiety reducing medication use for cats and dogs in shelters. And we just want to know, regardless of if you prescribe medication or not, some of your perspectives and practices in this regard. So if you have the time to fill out the survey, we would greatly appreciate it. So with that, I will finish up. Thank you so much for listening, and I'm really looking forward to chatting more about this.
Awesome. Thank you so much, Bailey, for sharing these really exciting results. I think these are cats that people have been frustrated with trying to help for so long, and it's just incredibly heartwarming to see the results that you had with this study. And we have lots of questions for you.
Fabulous.
So you shared the QR code for the BMOD resources. Can you confirm or let our viewers know whether those resources also include the tracking sheets that you?
Yes, that's a great question. So it will bring you to a website that has all of the, you can download everything. And then as we get more languages and things, that'll all be posted on the website. My goal for that is just anyone that could make use of it to have it. So please use freely and share.
Wonderful. Thank you, Bailey. Our next question is from Nadia, who asks, how many staff members were participating in the BMOD sessions, and were only behavior staff members able to participate in the plan, thinking about shelters who don't have behavior staff and how they could carry out this type of program?
Yes. So approximately, so at a given time, the most cats we would have in the shelter would be 12. And then we would have about 5 individual staff. It did change. We did it over a number of months. So the individuals changed, but each cat probably got exposed to 5 or 6 unique people. And we did have a range where we had our shelter manager, who was a behavior expert, and all ranging up until people who had very, very limited cat experience. And the way that we trained on the behavior modification is we just talked about it. We went through each phase. We did a quick 20-minute meeting. We went through each phase, and then we had one more experienced person go in with somebody who was less experienced, do a couple BMOD sessions together. And we found, following these steps, especially if you're really erring on the side of making sure the cat's comfortable, reading their body language, and going really slow, we found it didn't take too much training for people to be able to implement these steps, because they were fairly simple. If there was a particularly challenging cat or something, we'd try to prioritize that to our more experienced people. But we did find people learned pretty quickly and could apply it. So to say that quicker, it wasn't just behavior staff.
Thank you. Next question is from Kim, who's asking whether the shelter gave the gabapentin every 12 hours or did that have to be modified because of staff hours?
So we had it every 12 hours because we kept our shelter open for every 12 hours. But I know just for the sake of the study, we had to have that level of control. I know that in practice, shelters will commonly just have the first person coming in and the last person leaving. Like I certainly up to the veterinarian's discretion, but I know if you can get it pretty close to 12 hours that I see that done often as well, especially for the low dose of GABA.
Thank you. Next question is from Melissa, who asks, what % of these cats ate in the presence of a human the first time that they were given the opportunity to do so?
Oh, that's a great question. I want to, I could get that data with, if you follow up with me, I'd be happy to give that. I'm just going off memory here, so I can't say an exact percentage, but roughly I would say only 60%, maybe 50 or 60% on that first try. But then what we'd do is we'd go and we'd offer the food and we'd stand back about 3 feet and then we'd come and check. And then usually by the next couple BMOD sessions, they'd get a little curious, and that's where we were kind of trying all the different high value foods and things. So they did progress quickly through that one, but it wasn't right away. So yeah, I would say a little over half the cats would feel comfortable right away. And we'd put it down and we'd wait about 2 or 3 minutes to see. And sometimes they wouldn't at first, but then they'd, kind of keep peeking. And then eventually they'd take a little bit. And then afterwards we'd go and grab it. And then the next time we went, that delay to start eating would usually decrease. So they all progressed quickly, but it wasn't necessarily on the first try.
Great. Thank you, Bailey. The next question is from Nadia, and there's one other person who I'm going to tag onto this because they were asking something similar. And that is, were the cats taken off of gabapentin after graduating from the program? And if not, when were they taken back? And then also, did you see any behavioral setbacks when they were taken off the gabapentin?
Right. Great question. So we took them off gabapentin or placebo once they graduated our behavior modification program, and we just stopped because they were on the low dose. We were able to just cold turkey stop. We didn't need to wean them off or anything. So basically, once they hit that 3 6s in a row, someone would come out and say, "This cat's graduated," and they'd be crossed off the medication list. So that was immediate. We didn't see backslides afterwards. So once we did find once they were graduated, they stayed graduated. Anecdotally, from talking to adopters, they did, once they got into homes, they went back, they didn't maintain that comfy approaching us without treats attitude right away in homes, but quickly they did get it back as well. So the only kind of backslide that I heard about anecdotally was the first week in the home. Understandably, the cats took a little bit of settling in. And oh gosh, did I answer both parts there?
I believe
yes,
you
I think
did.
so. Sorry, yeah. Did they backslide? And
yes, you did.
When
yes,
did we
thank
stop?
you.
Thanks, sorry.
And then another related question. So given that they did what backslide some once they went in the home, would you recommend that the gabapentin be restarted as they transition to a new home?
So I'm not aware of any research, and so I'd certainly be curious about people's clinical experience with this because I wouldn't know, but I wouldn't be surprised based on everything we see about it decreasing situational fear, and now what we see of it helping them adjust to the shelter. I see no reason it may not also help in the home. So I don't know, but personally, I would think that yes, that could be helpful and could be worth trying, especially if a cat's highly fearful. But I think it would go beyond my expertise to recommend that or not. But I certainly think based on the research, it would be worth considering.
Thank you, Bailey. Melissa asks how often these cats spontaneously ingested the gabapentin when offered in food items or on the paw.
Yes, so It was a small number on the paw. I think we had 2 or 3 cats that for some reason that seemed to work. Most didn't. I think it's about an even split between those that tolerated the syringe catheter approach and those that tolerate. So I'd say maybe, like about maybe 45% on each side there. So we were happy. So something I hear a lot about with gabapentin is that people have really tough experiences getting it into cats, in that they hate the taste. And I do wonder a bit, like maybe our liquid formulation was helpful in that sense, because we did have a decent amount of success, like close to half of the cats would eat it out of the food. Some wouldn't touch it, but it did take some trial and error of like, often what we would make a plate, we'd have like 10 different kinds of food, and often they would quickly show those preferences, and then we'd try to mix up the gabapentin and a lot of that, and we did have a decent amount of success with that. And then if not, we would be using the syringe. The paw approach was very specific to a couple cats. Most would ignore it, and then we quickly learned that was not useful. So it was really about having the tasty enough food, like those squeeze up treats were often what we'd use to mix gabapentin, and it seemed to go well for us.
Thank you. And Madonna asks, what were the behavioral reasons that the 2 cats were euthanized?
Yeah, so, I'm not sharing my screen anymore. I do have data from one of them. One came in and it was highly fearful right off the bat. Certainly the vet team thought it seemed like it was more of a feral cat that perhaps wasn't even an indoor cat, and based on, it would be a great candidate for trap neuter return, but it was not possible in this situation because of the hoarding case and because of where we were. So that cat was so petrified that it seemed that its welfare was severely compromised every day. After 5 days, it was still not showing any sign of progress, so it was euthanized. And the other one was Mochi, and he was a very sad case because he had come so close to graduating, and then he got a really bad ear infection, and he had an ear infection, needed eardrops after he got neutered. We later saw, once we started kind of pairing us with all of these things that were likely painful, of adding in eardrops and applying medications and things, it's his BMOD totally backslid. So he was one backslide that when I look back at his data now, unfortunately, I didn't have time to show it, but it did make me really wonder about in these behaviorally vulnerable cats where, yes, they progress, but it might be precarious too, and you have to be really careful not to, we're pairing us with positive things, but in this vulnerable time, I think we paired us with painful things too, and from what I could see, it caused a backslide, or what I believe caused a backslide for him. And then once he had this negative association with us, he was unblinded, he went on stronger medications, we tried foster intervention, and he just never recovered. So despite being almost graduated, he totally backslid. So those were the 2 circumstances of one was quite immediate, and the other one was unfortunately much tougher, and I think could have been prevented now that I look back.
Thanks, Bailey. And I think that's something that we need a lot more learning and research around, because I've had very similar experiences related to animals you're making really good progress with, and then a single event that is aversive to them changes their opinion of how they perceive things, and it's really hard to recover that. So thank you for just talking about that.
This is the data I was talking about. Yeah, I thought I'd quickly show that since I have it here, but unfortunately this was one of them. So yeah, I'm sorry to hear that. It sounds like that is a experience that others have had, and I see other experiences. So yeah, I'd love to look more into that at some point too, if possible.
All right, thank you. We will go ahead with the next question, and that is from Natasha, who asks, where can we find more information on the cat stress scoring that you used?
Yes, so that is Kessler and Turner. It was in 1997 that they developed it. I think it's the most widely used measure in cat research. I bet I could get that. Well, I can add, maybe I'll add it to the forum afterwards, but it's if you just Google cat stress score Kessler and Turner, it's really and that's Kessler and Turner, and it's very widely used, very easily accessible, and there's some concern that it's a really rough measure, but we actually have found that it did seem to correspond well with our other measures and things. So after using it more, I like it. I think if you need a quick behavioral scoring, it could be useful.
Thank you. Petra asked about housing and whether all the cats were in similar cage sizes and setups, double wide versus single, and were they all housed individually?
Great question. I should have got more into that, actually. Everybody was in double wide portalized enclosures with the same setup. And then once they were meeting the minimum welfare criteria and entered into BMOD, since they came from group housing environments, we'd keep them in same-sex rooms. And then we would try to, unless there was any sort of behavioral issue between cats, generally they'd all just come from the same very small area. So they did well together, and they were quickly let out into group housing. So first couple days was in double wide housing, and then same-sex group housing in the room. And we recorded which day they went into group housing. I don't think it was controlled enough for us to see BMOD score, because we had that big to see whether BMOD progressed faster once they were in group housing, but I wouldn't be surprised with cats that are so bonded like that perhaps there was some kind of learning through watching maybe going on, but we unfortunately couldn't assess that.
Thank you. Megan asked, you mentioned that the latency to emerge happened when you expected that the gabapentin was reaching therapeutic levels. At what point or time is the therapeutic level of gabapentin reached?
Yes, I believe it's about 90 minutes to 2 hours, I believe, is the approximate range. I don't have I believe it's about 90 minutes plus half hour, but I'm sorry, I can't remember the exact timing. And the paper that discussed that was Gurney and Gower, 2022, I believe.
Thank you. Melissa asks, would you consider replicating this study with groups with no BMOD and no gabapentin, as well as no BMOD plus gabapentin? And then she has a comment. We do have a BMOD program for cats with no history of prosocial behavior at our shelter, but we don't see that a substantial percentage of our fearful cats come from hoarding situations. So I'm curious about the difference in time to soliciting affection from humans between hoarding cats that receive BMOD and those that don't.
Mm-hmm. Yes, I'd love to do that study. That would be a very exciting one to do. The reason we didn't for this was because we were working with ethically, the shelter nor the university would allow that, because we would be taking away treatment that we would be expecting would be beneficial. However, what I dream of one day is naturally capturing that in an environment where there isn't gabapentin or placebo, and then adding that in and seeing isn't gabapentin or behavior modification rather, and adding that in to see if we could see differences, because I think that level of control, exactly what you're saying, would be really, really interesting to see those results. And I would expect gabapentin and behavior modification would be helpful each individually, but yeah, we couldn't really know unless we see it that way. And then comparing kind of like a standard fearful shelter cat to a hoarding environment cat, my thought is just that you're dealing with often, on average, more medical conditions that might be also making everything a little bit more challenging, but then generally very, very low socialization and unknown history. So who knows really, but for the most part, they haven't seen much or done much or been exposed to much. So generally, I just expect these to be extra fearful. But I do know, it sounds like this behavior modification by no means is used, I'm sure, similar to your program. And I'd love to see what kind of programs everyone else is doing too. But I know they're used in not just hoarding cats, that fearful cats anywhere seem to be benefiting from behavior modification.
Thank you. And to tag on to that, Laura asked whether you have any other studies planned with gabapentin.
Well, right now the survey study, just trying to figure out if other shelters are reporting success of gabapentin, so that one I shared that we're surveying across North America. Additionally, with gabapentin, no, I think not immediately. I have a lot of research ideas, and certainly be open to applying it in other settings. I'd also be curious about other medications based on what people are reporting success with in the survey study, as well as diving into the behavior modification side as well. But I'd be interested. I mean, gosh, so many people have experiences with gabapentin seeming to be beneficial in other settings and environments. So I think there's tons of research opportunity for sure.
Thank you. And we are just about out of time. So I'm going to just ask a couple more questions that I think you can give a really quick answer to, and then we're going to finish up. Michelle asked, can you share the reference for the study from the beginning of the presentation regarding the outcomes of hoarded cats?
Yes, that is Jacobson and colleagues, 2022, and they have a 2020 or 2021, and that's in the Journal of Feline Medicine and Surgery, and it's open access. And I'll be adding all of these, I'll be following up on all of these in the forum afterwards as well. So I'll link those studies.
Okay, thank you. Evelyn asked what type of catheter was used to give the gabapentin?
Oh, it was the widest gauge one that we could find. We just cut it off and put it at the end of the syringe. I can't remember the specifics. A Tomcat catheter, I believe we were.
Yes, it was. I remember from your other presentation, it was a Tomcat catheter.
Thank you.
All right. Well, we have lots more questions that we unfortunately did not have time to get to. I want to thank everyone for joining us. Bailey will be answering these additional questions on Maddie's Pet Forum. So please join us there to continue the conversation. I also want to make sure that all of you know that there's a new grant opportunity from Maddie's Fund where you'll be entered to win a $3,000 grant just for participating on Maddie's Pet Forum. And this happens monthly. But go to the forum and see the additional questions that are asked. And Bailey, thank you so much for the amazing work that you're doing. And thank you to everyone for joining us today.
Thank you so much. It was delightful to be here and talk to everybody.